Imagine this. In Ghana and the United States alone, 1 in about every 8 women will be diagnosed with breast cancer in her lifetime. That is not just a statistic, it is a startling reality that touches families, friends, and communities across nations and the world at large. But here is the most empowering part. Knowledge is the first step towards prevention. Today, we are delving into the latest scientific research and insights on breast cancer risk factors to help you take control of your health. Welcome to our Breast Cancer Awareness Month special. But before we continue, if today is your first time watching my video, kindly subscribe, like, and comment down below with your thoughts. Breast cancer risk factors are things that increase the chance that you could get the cancer. There are some risk factors that we can control, such as drinking of alcohol, and others beyond our control, and these mostly are genetic factors. The more risk factors you have, the more your risk increases. However, it does not mean you absolutely will get the cancer. Many women who get breast cancer do not have any known risk factors or family history. Understanding your risk factors can give you a better picture of what you can do to help you prevent breast cancer. Of all the types of cancers, breast cancer is one of the most talked about, and with good reason. As we already mentioned, 1 out of every 8 women will develop breast cancer sometime in their life. That is why every woman should be thinking about how to protect herself from this disease. Breast cancer is cancer that forms in the breast. You have to take note of that. Usually it begins in the tubes that transport milk from the breast to the nipple. If the cancer spreads to other parts of the breast or body, it is called invasive breast cancer. Some breast cancers are more aggressive, growing more quickly than others. Although women are 100 times more likely to develop breast cancer, men can also get the disease because they also do have breast tissues. According to the American Cancer Society, when it comes to breast cancer, genetics play a significant role. Recent studies have identified specific genes like the BRCA1 and the BRCA2, that's the BRCA1 and BRCA2 genes, that increase one's susceptibility to breast cancer. If you have a family history of the disease or carry these mutations, your risk is higher. But remember, genetic risk is just one piece of the puzzle. Also, your lifestyle choices matter too. Recent research has shown that maintaining a healthy weight, engaging in regular physical activity, and limiting alcohol consumption can all help reduce your risk of breast cancer. These are changes that you can make today to positively impact your future. Furthermore, hormones also play a crucial role in breast cancer. Latest findings suggest that women who have undergone hormone replacement therapy, that's the HRT, for menopause have an increased risk. It is essential to discuss the benefits and risk of HRT with your healthcare provider if it is part of your treatment plan. Nevertheless, the key to fighting breast cancer effectively is early detection. Recent advancements in imaging technology like the 3D mammography and MRI have improved our ability to catch cancer in its earliest stages. Regular screenings and breast self-exams are your first line of defense. In conclusion, knowledge is your greatest weapon against breast cancer. By understanding your risk factors and adopting a proactive approach, you can take control of your health. Remember to consult with healthcare professionals for personalized guidance. Together, we can work towards a future where breast cancer is preventable. Thank you for joining us in this important discussion about breast cancer risk factors and prevention. Share this video with your loved ones to spread awareness, and don't forget to subscribe for more important updates. Together we can make a difference and work towards a world where breast cancer is not just a problem but rather a thing of the past. Stay informed, stay vigilant, and stay healthy. Also check in the comment section below. There is a link to a video on risk factors you can control and ones that you cannot control. Bye bye.